So now here let us discuss about some psychotherapies. Psychotherapy, right? So so here I will write the types of psychotherapies and I will discuss. So first is your psychoanalysis. Psychoanalysis. So psychoanalysis, the main goal is your resolution of neurosis, right? And duration is almost 4 to 5 per week for years. Techniques used in this psychoanalysis is your free association, defense analysis, interpretation of transference. So what is transference actually? So transference is the the emotional connect between the patient and the doctor, right? The emotional connect, the emotions that are transferred, right, from patient side and from the doctor side, right? So in psychoanalysis we see what techniques: free association, defense analysis, and interpretation of transference. Next is your insight oriented. So here the goal is to focus on interpersonal goals, right? There the intact reality testing is done, capacity for insight is tested, and 1 to 3 is the duration, right, per week for months to years, right? And here what are the techniques, right? It is a defense analysis and interpretation of transference, same as psychoanalysis. Next is your supportive. Okay, so while we talk about supportive, the goal is to support reality testing or to provide ego support. So in which patients we use this supportive therapy? It is the healthy patients in time of crisis or very ill patients, right? And the duration is days to months to years, right? And techniques are usually problem solving, suggestion, reinforcement, right? These are the techniques. Just remember the names, okay? Next is your behavioral. So in behavioral, the goal is to modify learned behavior patterns, and thus patient criteria is those who have maladaptive behaviors or psychophysiological disorders, right? And the duration is actually time bound, okay? There is a limited limited time, okay? And the techniques used are relaxation techniques, aversive therapy, systemic desensitization, flooding, or token economy. Token economy is like, instead of giving money as reward, we are giving them token which they can use in future as reward. Okay, so these all comes under behavioral techniques, right? So behavioral therapy. Now there is behavioral therapy I have discussed in brief in another video. You must go through that. This is important one, okay? And then there is group therapy. So group therapy, actually the goal is to elevate the symptoms, change relationships, or alter the family couple dynamics, right? Because the patient selection criteria is your group target specific disorders, that family and couples, personality disorders, etc. Duration is almost 1 per week for week to years, right? So technique is actually group specific, right? So the target or the selection criteria, as I mentioned, is your personality disorders or family and target couples, like that. And last is your cognitive, right? So cognitive therapy, actually the goal is to change the distorted views of the self or the world and others, right? Selection criteria is patient with depressive disorders. Duration is 1 per week for 15 to 25 weeks. Technique is assigned readings are given, homeworks, behavioral techniques, identification of irrational beliefs, attitudes. These are your techniques, right? So this is all about psychotherapy. Of them, most important being your behavioral ones, okay?